Hello and welcome to Arizona DUI Services 16-hour DUI education. This is our module 2, Understanding Blood Alcohol Concentration. In this module, we are going to cover how alcohol and drug use affects an individual's ability to operate a vehicle, how an individual's alcohol concentration is measured, the criminal penalties and statutory requirements for sentencing DUI clients, and alternatives to operating a motor vehicle while impaired by alcohol or drug use. Now, the reason that we are covering some of these things is because alcohol and drug use impacts your ability to drive. Drunk driving makes up 32% of all driving fatalities in the United States. So 1/3 of all driving fatalities are DUI related. Safe driving is going to require us to have complete concentration, sound judgment, reliable motor functions, and the sound judgment and concentration, as we said before, these are called cognitive functions. And we're going to need to have all of these in order to be a safe driver. We need to have our full faculties about us. The cognitive functions are high-level activities that lead to knowledge. These high-level activities include finding, gathering, reasoning, and processing information, leading to knowledge. Now, alcohol acts as a depressant on the brain and the central nervous system. This delays our cognitive function as well as our motor skills. Alcohol impairs cognitive ability, leading to poor judgment and reduced concentration. And our impaired motor skills result in compromised eyesight as well as delayed response time. Cognitive function affects the ability to, an impaired cognitive function affects our ability to properly react, especially to the unexpected. This is going to increase our risk of being involved in a motor vehicle collision. As we discussed in Module 1, alcohol impairs your judgment, which then hinders your ability to identify potential hazards. When you don't identify potential hazards, they are then going to become unexpected. This decreases your response time, and with your impaired motor skills, you cannot execute evasive maneuvers properly. These are the things that alcohol and drugs do to us. They affect the way we see things and process things, and they slow the way we react. Speed limit, the proper lane, as well as the color of the up and coming light signal all require parts of our concentration. Add a radio and a cell phone, and now as you're driving down the road, your brain is processing 4 to 6 different things simultaneously, and this is even challenging for sober drivers. Now, when I was doing my research for this course, I found a study out of the University of Utah, and they were conducting a study on how well humans multitask. And what they found is that when people are driving and they have a radio on, they have a decreased reaction time as if they were just driving with no radio. They then had the drivers listen to an audio book, and this decreased their reaction time even more than simply listening to a radio. They then allowed the drivers to talk on a cell phone, which decreased their reaction time even more than the radio or the audiobook. And then using a hands-free device like a talk-to-text or a talk-to-email, this decreased reaction time even more than the other 3. What the study found was that humans are poor at multitasking. Now, even a small amount of alcohol is going to adversely impact your focus, and this is going to result on not concentrating on the most important events. So, as the study from the University of Utah showed, we have a problem multitasking as we drive. Alcohol is going to exacerbate those deficiencies. The depressant effects of alcohol on the central nervous system are going to impact our motor function, which is going to reduce the function of our skeletal muscles. Also, they're going to impact the iris of the eye, which is actually a muscle itself. Alcohol causes blurred or double vision, reduces your peripheral vision, and it's going to impact your ability to identify visual and spatial relationships among objects, or as people call it, the visuospatial abilities. Alcohol's suppressing properties diminishes the eye's capacity to constrict or to dilate the pupil, and this makes adjusting to oncoming headlights a complex issue. So at night, that's why it's hard to adjust to those lights, those headlights, those bright lights when you've been drinking, because the iris, and most people don't understand that, is actually a muscle, and that muscle contraction is impaired because of the alcohol. The first ability to be impaired when we drink, as we've said in the previous module, is our cognitive function, and this results in poor judgment. Impaired cognitive functions constrains our high-level actions, and the constrained cognitive function is evident in our lack of emotional impulse control. Poor judgment is the foundation of risky behavior. As people, we all know people, we may have been those people. As we drink, we start to do sillier and sillier things. We tend to give in to risky behavior because we're not thinking correctly. Now, again, people drive drunk without knowing they're drunk simply because their cognitive abilities are impaired. They don't understand they've had too much to drink to drive. And that is a huge issue. This is where this all starts. Now let's go ahead and take a look at how blood alcohol concentration works. The percent of alcohol in the bloodstream is how the blood alcohol concentration is measured. Blood alcohol concentration is a valued measurement because it provides law enforcement agents with a standard and universal benchmark when they consider the effects of alcohol. So if one person has a 0.08 BAC, they're going to have the same sorts of behavioral or impairments as anybody else that has a 0.08 BAC. It's a standard measurement. Now, an individual's size, gender, and physical condition is going to play a role in when a person's BAC peaks, not anything other than when your BAC peaks. You may have heard that BAC is expressed as blood alcohol content, but there's a big difference between content and concentration, and allow me to show you the differences. If two different sized people consume the same amount of alcohol, they will have the exact same content of alcohol in their bodies. However, because they're different in size, each is going to have a different blood alcohol concentration. That's the differences between content and concentration. So when you hear people say, what's your blood alcohol content? That's not necessarily the term. The term is blood alcohol concentration, and the reason why I just explained. Now, I'm going to take it a little further. If we compare two men, one man weighs 150 pounds, the other, let's say, weighs 300. They each drink a bourbon on the rocks. The alcohol would then be absorbed throughout their bodies, and as you assume, the alcohol is more concentrated in the smaller person. That makes sense. This means that the BAC of the smaller person is going to be higher since the alcohol is more concentrated when compared to the larger person. Now, although this is a technicality, the difference between concentration and content are definitely meaningful. Now, factors that impact blood alcohol concentration are body weight, strength of drink, size of drink, gender, and time spent drinking. As we discussed previously, body weight can play a significant impact in a person's BAC. A smaller person will contain less blood mixed with the alcohol. This is going to result in a higher BAC than someone who is a larger person. The strength of alcohol beverage can also affect the BAC. The higher the content, the higher the resulting BAC. When we discuss the strength of an alcoholic beverage, what we're talking about is the percent of alcohol in the drink. Often alcohol containers are going to provide you a proof of the drink and not necessarily the percentage of alcohol. But there is a formula that's going to help you determine the percentage of alcohol based on the proof. The proof of the alcohol divided by 2 gives you the alcohol percentage. And as you can see in this picture, the volume is 50%, the proof is 100. So if you took the 100 proof, divide that by 2, it gives you 50. So you can see in this 700 milliliter jar, half of that is actually alcohol. The size of a drink obviously is going to impact the BAC. If someone drinks 3 ounces of wine as opposed to 6 ounces, obviously consuming more of the alcohol is going to give you a higher BAC. Time spent consuming alcohol plays a significant role in the BAC. The shorter time between drinks, the higher the BAC. So if somebody has 2 beers and they have both of those beers in 1 hour, your BAC is going to be higher as if he had 1 beer in 1 hour and a second beer in the second hour. And you can also see that it doesn't take too many drinks to actually make your BAC increase or rise fast. Now, you may have heard that eating something while drinking can stop you from getting drunk, or you may have known somebody who's eaten an entire loaf of bread, maybe drank half a gallon of milk, or even eaten a stick of butter. And they're doing this because what they're trying to do is what they think is going to happen is going to soak up the alcohol, or it's going to coat the stomach lining to prevent the absorption of the alcohol. None of this is going to prevent the alcohol from being absorbed into your bloodstream. Food consumption before or during drinking only affects when the BAC peaks by slowing the rate at which the alcohol is absorbed into the body. However, eventually all of the alcohol is going to make its way into your bloodstream. You can't avoid it. When we look into how the body eliminates alcohol, the old rule of thumb of 1 drink per hour, it's a myth, and it's a dangerous myth at that. This myth may have contributed to some drivers thinking they were sober when they still had enough alcohol in their bloodstream to affect their driving abilities, and may have even produced or gotten some people some DUIs. Now, while believing that 1 drink per hour is a convenient formula, it's just wrong. It actually takes anywhere from an hour and 15 minutes to an hour and a half, or for some people even longer, for your body to eliminate what was contained in just 1 standard drink. Now, to demonstrate how the body rids itself of alcohol, let's go ahead and run through a scenario. Let's say that a man starts drinking at 9 p.m. and he averages 2 drinks an hour. By 11 o'clock, his BAC is at 0.07, so he's almost at the legal limit. He's going to continue drinking throughout the night, and at 1:30, he's going to call it a night, and he starts to go home and he goes to sleep. Now, his BAC is going to continue to rise for the next 30 minutes after he's done drinking. And this is because it's going to take a while for the alcohol to be fully absorbed into the bloodstream. And this is causing his BAC, his blood alcohol concentration, to rise even higher after he's done drinking. Finally, at about 2 o'clock in the morning, his BAC peaks. So he quit drinking at 1:30. At 2 o'clock, his BAC will peak at 0.16. And again, 2 drinks an hour from 9 to 1:30 is going to peak at a 0.16, which is twice the legal limit in the state of Arizona. From then on, from that point, it's going to be all elimination for the body, as his BAC begins to fall at the average rate of 0.015 per hour, which is about 3/4 of a drink per hour. As he sleeps, his body's going to continue to eliminate alcohol, but it's going to be at a relatively slower rate when you compare it to how fast it rises from drinking. By the time 7:30 rolls around, his BAC is still at a 0.08, so he quit drinking at 1:30. It's now 7:30. His BAC will still be at a 0.08, which is legally intoxicated. So if he has to get up and go to work at 7:30, or he has to drive somebody somewhere, this is going to be problematic because he's still able to get a DUI. By the time 9:30 rolls around, the alcohol level had fallen to a 0.05, which isn't above the legal limit, but is still too high to be driving. By the time 1 p.m. the following afternoon rolls around, he'll be at a sober state with a 0 BAC. So he quit drinking 2 drinks an hour from 9 to 1:30. He quit drinking at 1:30. It's now 1 o'clock the following day, and now his BAC is at 0. And then even at this point, he still may be impaired by the effects of a hangover. The bottom line is that it takes much longer for the body to eliminate alcohol than most people believe. A scenario like this could happen because the next day, the drinker is comparing how they feel to the worst that they felt the previous evening. They probably feel better now, but that doesn't necessarily mean that they're sober. Their judgment may still be affected by alcohol, so they're not making good decisions. Now let's look into how the BAC is measured. Law enforcement agencies are going to utilize 3 different methods to measure your blood alcohol concentration. The most common way to measure your BAC is a breathalyzer. So about 5% of alcohol consumed leaves the body through urine, sweating, and breathing. And the breathalyzer is a quick and accurate way to determine an individual's BAC. And about 90% of alcohol is processed through the liver. And as we said in Module 1, it has major effects on the liver, alcohol use does. A blood test is the most accurate but invasive method to determine an individual's BAC. And the least accurate method to determine BAC, but also the most uncommon method, is a urinalysis. Now, according to the CDC, the amount of alcohol consumed has varied effects on an individual's behavior, cognitive function, motor skills, and is going to grow progressively worse with each drink. In Arizona, like 49 other states, authorities have determined that intoxication occurs once an individual has 0.08 grams of alcohol for every 100 milliliters of blood. 0.08 is the legal limit of intoxication in the state of Arizona. On a side note, Utah is 0.06. So if you're in Utah, plan on having a drink and driving, which I don't recommend, but if you do, no, 0.06 in Utah is their legal limit. So some things to remember, again, you're going to see this on the final. Nearly 32% of all driving fatalities are directly related to drunk driving. Urinalysis is the least accurate method of measuring the BAC. Measuring BAC takes into consideration gender, size, and the physical condition. Alcohol adversely impacts your concentration, judgment, motor skills, and eyesight, increasing your probability of a motor vehicle accident. Consumed alcohol is stored as vapor until absorbed. This makes breathalyzer, an effective tool for measuring BAC. Now let's go ahead and take a look at the effects of alcohol at different levels of BAC. As the BAC increases, your ability to operate a vehicle decreases as drivers use a variety of abilities to operate a motor vehicle. One of the first mental abilities to be compromised by alcohol is your ability to divide your attention while driving. Remember, we just discussed multitasking, and alcohol has an impact on your ability to multitask. So at 0.02, which essentially is just one drink for an individual of medium body weight. At 0.02, the individual has a transformed mood and sense of relaxation. The brain is slightly impaired, and decision-making, eyesight, and concentration are becoming altered. You can see that even at low levels of alcohol, our driving performance is going to be impaired, and because alcohol affects our judgment and decision-making early on, we're not making accurate assessments of how the alcohol is affecting our driving. I mean, it's simple. Drinking and driving doesn't mix, even with a beer or a drink. At 0.05, which is 2 to 3 drinks for an individual of medium body weight, inhibition is lowered, your judgment is impaired, inflated sense of self with obnoxious loud speaking and exaggerate movements. Motor function is delayed, causing slower response time, and discernment is affected. You grow less aware of your surroundings, concentration is complex, and vision is blurred. And that's at 0.05, again, 2 to 3 drinks for a medium-sized person. When your BAC hits 0.08, motor skills are disjointed and coordination is off. Reaction time is delayed, enough to be considered unsafe. Concentration is deficient, and short-term memory loss is possible. Again, Arizona believes anybody with a 0.08 BAC is a danger and beyond the legal limits of intoxication, and you can get a DUI for 0.08. At 0.1, the individual is visibly intoxicated. Motor function and coordinations are challenged, negatively impacting your reaction time. Speech is slurred, and concentration, judgment, and reasoning are going to be obstructed. At 0.15, which is an extreme DUI in Arizona, it's nearly twice the legal limit, but 0.15 will cause motor functions to be inhibited, resulting in less control of your voluntary muscles. Becoming off balance and falling and sustaining an injury is concerning, and vomiting is likely at 0.15. When an individual's BAC hits 0.2, they can be confused and disoriented. Motor function may be obstructed to the point of actually needing assistance to stand or walk. The brain is so impaired, the individual may not feel the pain generally associated with a fall. Aspiration is a concern because of an impaired gag reflex, and blackouts are common, making it difficult for individuals to remember what they did. And that's at 0.02, twice the legal limit in the state of Arizona. At 0.25, all cognitive related functions are seriously impaired by the amount of alcohol in the bloodstream. The inability to adequately process sensory functions leaves the individual feeling numb. The real risk of aspirating on vomit and incurring self-inflicted injuries. 0.25 BAC. When the BAC reaches 0.3, the brain has stopped performing any high-level cognitive functions. At this point, the brain is merely regulating heartbeats and respirations. The individual may seem awake, but the brain is incapable of responding to even painful stimuli. 0.03, an extreme DUI, super extreme DUI. At 0.35, which is the equivalent of surgical anesthesia, the person will likely pass out, and there is a possibility the individual may stop breathing. We're starting to get really dangerous here. 0.35. At point 4, the blood is so toxic that a coma or sudden death are a possibility. So some things to remember about the different measurements or effects of BAC. Experts believe a BAC of 0.08 is impairing enough to consider the individual dangerous. The blood is so toxic at 0.4 that sudden death is a real possibility. At 0.15 BAC, your brain is impacted enough to make voluntary movements challenging. And again, that's an extreme DUI, nearly twice the legal limit. Your impacted voluntary movements can be challenged. 0.08 is the legal limit in the state of Arizona, and 0.35 BAC is equivalent to general surgical anesthesia. Now, regarding alcohol content. So a normal drink is either 1 ounce of an 86 proof liquor, 3 ounce glass of wine, or a 12 ounce glass of beer. Now, as I just showed you, 1 glass of beer and 1 glass of wine aren't weaker than mixed drinks. And in most situations, beer can actually sometimes be stronger. The bottom line is that beer and wine are strong enough to cause impairment. So when somebody believes that beer will not increase their BAC as much as a mixed drink, they're simply lying to themselves and setting themselves up for possibly a DUI arrest or worse. So again, 1 drink, when we talk about 2 drinks get you, or 2 to 3 drinks get you to 0.05, it's 1 ounce of liquor, 3 ounces of wine, or a 12 ounce glass of beer. Drinking 2 or more drinks in an hour for a typical person results in a measurable intoxication, and persistent consumption obviously is going to continue to elevate your BAC. It's important to remember that alcohol is processed via digestion, and your BAC will continue to increase up to 30 minutes after your last drink. So being in this field and doing this for a while, you'll see some admin per se's or some citations where somebody's first into the breathalyzer, let's say it's a 0.08, and then their second one is a 0.095, and then when they give blood, it's a 0.1. And the reason why that is because for the next 30 minutes after you stop drinking, again, your BAC is going to continue to rise before it starts to drop down. Now, the average male is 5'9" and 196 pounds. When we look at the Arizona Department of Public Safety's BAC chart, this is right off of their website, you can see that 5 drinks will put the average male over the limit of 0.08. Just 5 drinks. The average female is 5'4", 170 pounds, and the same chart shows the average female to be over the limit after 4 drinks. So let's go ahead and see, where your weight is over there on the left, the number of drinks to the right, and you're going to see what your BAC is. So I weigh about 200 pounds. 5 drinks puts me at 0.08. 6 drinks put me at 0.097. Again, you can see that it doesn't take many drinks to get you beyond the legal limit and to get you into some trouble with the law. Now we're going to go ahead and take a look at the criminal penalties for the DUI. Now before we do this, I want you to understand that these are the statutes. So these are the guidelines that the courts have when they give you your punishments or whatever it is that you need to complete. Some courts I've seen, they're kind of lenient on some of these things. Some ask for more, some ask for less. So these are just the Arizona Revised Statutes. These are the guidelines that the courts use when they're going to give you your penalties for your DUI. Arizona Revised Statute, ARS 28-1321. This states that Arizona is an implied consent state. Implied consent means that law enforcement can request a BAC or a drug content test with probable cause. ARS 28-1381 says to determine the driver's level of impairment, a sobriety test will be administered within 2 hours of operating a vehicle. The implied consent law is a separate law that states if a person refuses to consent to a blood, breath, or a urinalysis requested from the officer after being suspected of a DUI, then their license will be suspended for 1 year, and of that 1 year, it will be possible to get a restricted license after 90 days of no driving at all. So essentially what implied consent is that the law enforcement, if they see you driving, let's say you're weaving in and out of the lane, you make an improper lane change, whatever the reason is, if they believe that you're under the influence, the ARS 28-1321 gives them the right to pull you over and request you to complete a sobriety test. That's what implied consent means. And when you're in Arizona and you sign on the driver's license and it's yours, you have now signed that you understand that complied consent is a part of you having a license. Now, according to the ARS 13-3401, Arizona will utilize a urinalysis or blood test to determine acceptable levels of metabolites associated with each substance for drug-related DUIs. With that being said, here at Arizona DUI Services, we get clients that have used recreational cannabis. Arizona, nobody has developed a test that will let you know that if while you're driving, you are under the influence of cannabis, and cannabis stays in your system for an extended period of time. So if you are driving and they believe that you're on cannabis, they smell cannabis, and even though you haven't had cannabis in a week, if you do this drug test and it shows that you have metabolites, you're going to get a DUI, even though cannabis in Arizona is recreational. Remember that. An individual's license will be suspended if the driver is under 21 and has any detectable amount of alcohol or drugs in their system. I've had clients under the age of 21 with a .015 get a DUI because they were under the age of 21. A license is going to be suspended if they have a BAC or a blood alcohol or a blood or drugs in their system exceeding predetermined limits. Again, .08. The metabolites I'm not really familiar with, but there is a predetermined amount for different metabolites. If they refuse to complete all 3 sobriety tests. So again, individual's license will be suspended if the driver is under 21 and has any detectable amounts of alcohol or drugs, has a BAC or drugs in their system exceeding predetermined limits, or they refuse to complete 3 sobriety tests. According to the Arizona Revised Statute, a DUI, extreme DUI, and super extreme DUI are misdemeanor offenses, and an aggravated DUI violation is a felony. So you can see the 3 different categories Arizona has: .08 to .14 to the slightest degree, .15 to .19 is an extreme DUI, and .2 is a super extreme DUI. Those are the categories we have. And then there's also aggravated DUIs, which are then felonies. An aggravated DUI is a DUI which occurs when the driver has a suspended license and they get a DUI, when there is a minor in the car and they have a DUI, or they've been driving under the influence with a minor in the car, or they have 2 DUI convictions in the past 5 years, or if there has been caused death or serious bodily injury. So the aggravated DUI happens when you, again, been drinking on a suspended license, you get pulled over, you're driving with a minor in the car, you have 2 DUI violations in 5 years, or you've caused death or serious bodily injury during the violation. Those are the guidelines for an aggravated DUI. Now, the penalties for a DUI to the slightest degree, according again to ARS 28-1381, and like I said, these are the guidelines the courts have. There's some leeway. The judges can ask for more, they can ask for less, but these are the general guidelines. These, for your first violation, include an ignition interlock device for a minimum of 12 months. Some of you may be eligible to have that reduced to 6 months for taking the 16-hour course. A 90-day license suspension, mandatory alcohol screening, education, and or treatment, 10 consecutive days in jail, and a minimum fine of $1,250. Now, if it is your second offense within 7 years, outside of that 5 years, so it has to be within 7 years, the penalties are the same. However, jail time is increased to 90 days. Your license is revoked for 1 year. The fine increases to $3,000, and there's 30 hours of community service that are going to be required. Now, I know I have on here a third offense, but typically, in my experience, what I've seen is that your third offense, your third DUI, is going to be charged as an aggravated DUI. According to ARS 28-1382, penalties for extreme DUIs include an interlock for a minimum of 12 months. Your license is suspended for 90 days. There's a mandatory alcohol screening along with education and or treatment, 30 consecutive days in jail, and a $2,500 fine. For your second extreme DUI, within 7 years, the penalties are the same. However, your license is revoked for 12 months. Your jail time increases to 120 days, and the fine increases to $3,250. Now, according to ARS 20-1382A2, a super extreme DUI includes an ignition interlock for 18 months, a 90-day license suspension, mandatory alcohol screening with education and or treatment, an interlock device for 18 months, and 30 hours of community service. A second extreme DUI within 7 years is going to be a minimum of 180 days in jail, $4,600 in fines. You're going to have a 1-year license suspension, again, mandatory screening, education and or treatment, your interlock device for 2 years, and 30 hours of community service. Again, a third super extreme DUI is more than likely going to be charged as an aggravated DUI, so I don't have a third offense on here because of that. The penalties for an aggravated DUI include 10 years of probation, license revoked for 3 years, a minimum of 4 months in jail, and a $5,500 fine, along with the mandatory screening and education and or treatments. Aggravated DUI for people under the age of 21 includes a possible license suspension for 2 years or until you're the age of 21. Mandatory alcohol screening with education and or treatment, a $1,500 fine, and 1 day in jail. Some things to remember about the different penalties. Again, this will be on the final, so know this information. Aggravated DUIs are charged to drivers under the age of 21 with any amount of detectable alcohol or drugs, or an adult with a third DUI conviction in 7 years. An extreme DUI requires 30 days in jail. A second DUI in 7 years, your fines for a slightest degree are going to be $3,000. Super extreme DUIs require an ignition interlock device installed in your vehicle for 18 months. And adults with an aggravated DUI will have their license revoked for 3 years. Again, you will see this on the final exam, which you need to get a 70 on. Now, in Arizona, operating a motor vehicle while intoxicated is obviously going to result in a DUI offense. No question about that. The evidence is unclear if using anything with wheels, including rollerblades, skateboards, or bicycles, warrants a DUI conviction. We've all heard it. There was somebody or some guy they know on rollerblades that got a DUI for being on rollerblades. Now, in the research that I've had, I've not seen any DUIs for anybody on anything other than a motorized vehicle. However, Arizona DUI Services research, my research, found examples of the law enforcement ticketing individuals for public intoxication in cases of individuals operating modes of transportation with wheels but no motor. So bicycles, skateboards, rollerblades, they either got a ticket for public intoxication or disorderly conduct. So either way, being on something with wheels while you're drunk is not a good thing to do. In Arizona DUI's recommendation, we recommend that you stay clear of using any mode of transportation after you've been drinking. And some suggestions to consider as an alternative to drinking and driving. The first one is to utilize a designated driver. Designated drivers are free, and they're also going to keep your social network close. You're still going out with your friends. Now, as we discussed previously, alcohol impairs your judgment. So if you decide on a designated driver, determine who that person is before you start the evening. The designated driver should always be the sober one and never the one who's had the fewest drinks. We've all had friends or heard stories about the designated driver being the one who's the most sober. That is a bad way to go about it. Decide who the designated driver is before you go out. Make that decision. Next, rideshares like Uber and Lyft are also readily available. Most rideshare companies have an app you can download to your mobile device, making it convenient. Securing your ride and making a payment is as simple as opening the application, and they're often less expensive than a taxi. Check the availability of rideshare in your area, because I know that in some rural parts of Arizona, Uber and Lyft are not actually there. So check that before you go out and have a good time. Another rideshare option I know here in Phoenix is a service called driver.com. I don't have a slide for this, but it's DRYVER.com. And driver.com will actually have a driver take you and your car back to your home after you've been drinking. Like Lyft and Uber, driver.com has a downloadable app. I'm not sure what the fees are. I just know it's a service that is provided for people in Arizona. Again, driver.com, DRYVER.com. Lastly, the public transit is another option. Now, if you are going to go out and you live in Flagstaff, know that pickups vary depending on location. In Phoenix, the transit's last pickup is 11 p.m. Unless it's Saturdays, it's at 2 a.m. And in Tucson, the last pickup starts at 10. I do advise that you contact your local public transit provider to confirm these times so that you can manage your day or the responsibility according to that if you do decide to use public transit. That's it. That was Module 2. Again, there's going to be some more videos that you guys are going to watch, and again, another final assessment. Again, my name is Paul Fernandez. If you have any questions or concern, give us a call at the office. Send me an email, paulfernandez@Arizona DUI Services. I appreciate your time. I do hope that you're enjoying this and you are learning some new things. Take care and have a great day. Thank you.